neurology, pathology, herniations. All right, so for herniations, hard, fast rules I'm going to give you. If you see anything that's causing an increase in intracranial pressure, it can cause an uncle herniation. The most high yield one out of all these herniations are uncle herniations. Does that mean it's the only one they ask about? No, but it means that it's the majority of times when they're talking about herniations, the majority of the time they're talking about an uncle herniation, okay? So I want to start there. That's the first thing we need to talk about. So an uncle herniation, all that it means is that it's going to affect the medial temporal lobe. Okay. So whenever we have a herniation, an uncle herniation, it's going to lead to a classical kind of triad that you should keep an eye out for. Okay. So if you see cranial nerve 3, okay, if uncle herniation shows cranial nerve 3 deficits, okay, compression of cranial nerve 3. And so that means it's going to show dilated pupil, okay, ipsilateral dilated pupil. It'll have visual loss, potential contralateral visual loss. And 3, it can present with hemiparesis, either contralateral or ipsilateral. Okay? So those are the 3 things. Now, once again, uncle herniation is going to present with your unilateral cranial nerve 3 compression. So dilated or blown pupil, that's ipsilateral. You can have visual loss or hemiparesis. All right, very important. That's like so important. Once again, that blown pupil is probably going to be the highest yield thing for uncle herniations. Okay. Now, you might ask me, what causes an uncle herniation? Well, anytime that you have a hemorrhage, if a hemorrhage starts to expand in the temporal lobe, it can lead to an uncle herniation. So anything causing that increase in intracranial pressure can cause uncle herniation. But just think about the hemorrhages, right? If you have hemorrhaging at the temporal lobe in the temporal region, then that is most likely going to be leading to our uncle herniation, and it's going to present with the cranial nerve 3 deficits, compression of cranial nerve 3. All right? So keep that in mind. The blown pupil is probably the key thing there. Next is going to be the second highest yield one, really not that high yield at all. Talking about uncle herniation is number 1, and then is our cingulate or subfalcine herniation, all right? This is, all that it does is that you herniate across from one hemisphere to the other hemisphere, okay? And this can compress the anterior cerebral artery, okay? So you're gonna see deficits from the anterior cerebral artery, right? And we know that the ACA, where it provides all of its blood flow, makes sense in between the hemispheres, right? So whenever we have a herniation between those hemispheres, then it can compress the ACA, all right? And this is known as the cingulate or the subfalcine herniation under the falx cerebri. I think I remember a specific question asking about the falx cerebri. So remember subfalcine or falx cerebri, that is going to compress the ACA, that type of herniation. I'm not going to waste your time with the other herniations because I don't think they're that important. You know the cerebellar tonsillar herniation, right, into the foramen magnum. That can lead to, death, essentially, okay? It compresses the brainstem and it leads to coma or death. And then another one is the central or downward transtentorial herniation. You're going to see like posturing. That's common with that, okay? And you'll see like a rupture of the paramedian basilar arteries. Once again, very, very low yield. Focus on uncle herniation with cranial nerve 3 and the blown pupil, as well as the hemorrhage that can expand in the temporal lobe that can cause uncle hemorrhage or herniation. And then the cingulate or subfalcine herniation under the falx cerebri can lead to compression of the ACA. Those are your 2 most important things for herniations, and that's all.